So rolling forward, bringing you more examples of what we're doing on a day in, day out basis with patients locally and from afar. The other day we showed you a mercury test, a heavy metal test where we saw mercury off the charts. We got another one right now that just came in. This one is actually for small intestinal bacterial overgrowth, SIBO. Condition, when there are inappropriate numbers of certain bacteria, methane gas producing or hydrogen gas producing or even hydrogen sulfide gas producing bacteria or archaea found in your small intestine that shouldn't be there. And if those puppies are there, in addition to the damage that they can cause, when they eat certain foods, a lot of the times it's fermentable carbs, things like that. When they eat that food, raw vegetables, things like that, things that are usually deemed as healthy, and then all of a sudden there's no toleration for it. So that can be very frustrating to a patient. They're trying to eat healthy, noble efforts, but all of a sudden it's not sitting well because these bacteria are gobbling that up and then fermenting gases. And they ferment gases out of there, like we said, methane gas, hydrogen sulfide gas, and that can be the cause of a lot of different symptoms that they experience. That bloat, constipation or diarrhea, abdominal pain, belching, farting, one or the other. All of those things can be going on right there, and that can be very disturbing and disruptive. Really, this SIBO, small intestinal bacterial overgrowth, is seen in about 60% of cases of IBS, irritable bowel syndrome, which is kind of a, for lack of a better word, garbage can diagnosis. It just means you have some good issues right there, and you fall under a couple parameters, but it really doesn't give any answers. A lot of the time, SIBO is present, and if not outright causing it, definitely at least contributing to it. So it's something that you can identify and you want to address. This test right here can be powerful. The patient does it from their home. They have a solution. There's a little prep, about a 24-hour dietary prep. Supplemental-wise, you kind of trim down heading up to it as well. They take the test at the house. They drink a solution, and then they submit breath samples. All the stuff's included in the kit. They submit breath samples. I like to use the 3-hour test because it gets us down in the small intestine all the way to the large intestine, so we get a big picture of what's going on with the gas release in the body. And then they submit it. They submit it, send it in, and you get a nice documented level of different gases in the body, different levels. Hydrogen gas, methane gas. There's a third gas, hydrogen sulfide gas, that they're just starting to test for. It's just as prevalent. A lot of the times what you might see with that is low hydrogen levels, low methane levels on one of these tests, but they're still having the signs and symptoms. That's been one of the ways people have been diagnosing so far, running that concurrently with the patient's signs and symptoms. Because there's specific ones that you see a lot of the times with hydrogen sulfide, more on the diarrhea side. Just foul-smelling flatulence, foul-smelling burps, things like that, because of that sulfur. And they also have a little bit more of an intolerance to a high sulfur diet. So that's another resource you could look up to see what's going on right there. Whereas the SIBO diet might be more of the low FODMAP or a SIBO-specific diet. But everything is just a blueprint. It's usually individual to the patient. It's not always across the board. But this is a good place to start as far as investigating that, seeing what you need to do. And if you have the issue right there, just like we talked about with mercury, hey, let's do something. We found something on the test. It's the catch-22 of testing, right? You don't want to find things sometimes because you don't want to find a presence of that pathogen or that problem. But at the same time, finding something, number one, gives some peace of mind and some answers, especially if a patient's been going through things for years and have gotten no answers. When you finally found something right there, it can be reassuring and motivating to pivot to the next level of, okay, we identified a source here, let's get after that. Let's eradicate that, because just like there are specific therapies that you can go after specific metals or specific toxins in the body, depending on the gas producer right here, there are specific remedies, herbal, antimicrobials, botanicals that we can use to get after that certain strain right there. There's always the antibiotic option, which does, in studies, show to be work quicker, but not necessarily more effective in overall outcome. If the person wants to go more the natural route, it might take 6 weeks instead of 4. It might take 8 weeks instead of 4. But you go the natural route, you eradicate the certain type of gas producer right there, and you move on to the next and see what's up left. Check, keep going, keep improving the health, keep moving forward.